Dr. Mark and his team have just been alerted to an incoming patient with severe injuries. 23-year-old Zach has been in a horror workplace accident where his right hand got trapped in factory machinery.
Oh my God.
The glove of his pinky finger got caught in the rolling machine. Then he felt his hand go up and under through it. He says that his fifth finger was completely amputated. The other two are completely degloved down to the bone.
By the time paramedics arrived, Zach's workmates had already bandaged his badly injured hand.
I don't know if my pinky's gone.
Your mate put it all in a bag for us.
Me put my pinky in a bag.
Put his pinky in a bag.
How do you feel about it when you cut your t-shirt off?
I've lost my fingers. I don't care at this stage.
The emergency team must move fast. The priority is to prevent blood loss and infection, which causes damaged flesh to die.
What do you do for a living?
I make doors. Not anymore.
All I know at the moment is a young man has put his hand into a machine or something. He's lost a lot of skin and tissue off his fingers. One of my colleagues is in there with him at the moment. I'm just going to go and see how he's going.
Arms goes back from what I understand.
G'day. Zach, I'm Mark.
Nice to meet you, Mark.
One of the other doctors. You've got a lot of doctors. You'll meet a lot of us today.
You've had a bit popular right now.
Yeah, you're pretty popular right now. You don't have to be popular with doctors if you can avoid it. You've had a bad morning. What happened to you today?
Cleaning a glue roller at work.
Yeah.
Glove got caught in the roller.
Yeah, okay.
That was
it. Did you get yourself out, or? Yeah, good.
It was feet up against the thing and pulled as hard as I could. It was that or I lose my hand. It was just... I'd like to say quick thinking, but it wasn't quick thinking because it was the only option. But it was like, if I'd left it any longer, I don't know if I'd have a hand necessarily, so I got lucky. As lucky as this can be.
Zachary reacted pretty quickly. He put his feet up against the side of the machine, just pushed hard, pulled himself out, which was a life-saving decision.
You've done well. You've saved your own life there.
He left behind a good deal of tissue from his fingers and, I mean, potentially hand-losing injury.
What the doctors can do to save Zach's hand will depend on what they find under the bandage.
Sorry, mate.
It's do whatever you go.
Factory worker Zach is in shock after seeing his horrific injuries for the first time.
I'm not to look at it because it makes it worse, right?
Sorry for swearing.
The skin and flesh were ripped from his right hand when it got caught in machinery.
That's a devastating injury and a terribly frightening event too for a young person, for anybody. Some people really feel like they need to see it and, you know, it's their body. They're going to have to come to terms with it sooner or later.
Do I have a pinky? Yeah. I do? All right, well, that's...
You still with us?
Yeah, I'm wide awake. Not going to sleep anytime soon.
As doctors assess the extent of the damage, Zach is only now beginning to process the enormity of what's happening to him.
They're gone. What are the chances of me keeping my fingers?
I mean,
Pretty low.
It'll be a lot of operation,
Yeah.
to be honest, okay? And in terms of what we have to do, in terms of functionality after all the operation, it's going to be very... It'll take a lot of rehab to get to a functional level.
Yep.
Great, yeah.
Just do what you guys need to do.
Yeah.
He's got a tough time ahead. A lot of it will depend on which fingers he loses and what kind of mentality he's got too about life. Some people will, you know, just really hit a dead stop with this sort of thing for years and really struggle to recover. Other people lose a lot and get on with it. We don't know what's in us really until it happens.
So it was only my fingers that are broken.
I think just the fingers that are affected. I did hear them say that the bones and the tendons were intact.
Yeah, that's what they said.
There's a lot of extraordinary things to be done by the plastics teams with grafting skin and tissue on from other parts of the body. But the longer things are exposed to the outside world that aren't meant to be, like bone and nerve, the more infection is likely to set in, and infection will really be the enemy of successful salvage of that hand.
Zach's workmates recovered his skin and saved it in a plastic bag.
Pretty good, actually.
That quick thinking means Dr. Will Alexander and the plastic surgery team may be able to graft Zach's skin back onto his fingers.
Plastic surgeons need to do a lot of work with this because they want to try and salvage as much useful limb or whatever as they can, especially with hands. Any finger segment that's salvaged is an advantage to the patient.
Take the piece of skin and see if we can find some arteries and veins within it to put it back up to yours. Given the mechanism, it's probably unlikely we'll be able to do that next when they get ripped. And if we can't do that, we actually just make a little pocket in your tummy skin, bury your fingers in that, and leave that there for 2 or 3 weeks, then gradually divide fingers at a time.
True. That sounds cool.
Yep, so that's another option. It's a bit more old-fashioned, but it works.
Whatever, man. Try and save me fingers, please.
We're going to throw the kitchen sink at you
Let's have a go.
and try and do what we can.
Please do.
Zach will be on his way to theatre soon, where surgeons hope they'll be able to reattach his salvaged skin.
I'm going to take your fingers up and start having a look at them under the microscope now. Okay? I'll see you up there. Okay, good man.
As Dr. Will heads upstairs to prepare for surgery, Zach's family arrive to offer support.
Thank you for coming.
It's an overwhelming and confronting reunion for Zach's mum, Linda.
It's very lonely being a patient. You feel uncertain about what's going to happen. You have to make a lot of decisions. People come and talk to you about a lot of things you've never given any thought to before.
It's just such a surreal.
It's really nice to have someone who cares about you around. It makes a big difference.
All right.
We're off. We're going. Stairs.
Yeah, I'll see you later, Zach.
Love you all.
Love you too.
It'll be up to the plastics team now really do what they can to salvage his hand or as much of it as they can. It might take a number of operations to conclude the whole thing.
Zach's hand was ripped apart when he tore it free from heavy industrial machinery at work.
We're going to throw the kitchen sink at you
Let's have a go.
and try and do what we can.
Please do. That'll pop in the back and then you just screw them on.
It's 1 week later, and Zach's still in hospital.
Bit tricky with one hand.
His sister, Georgia, is a constant visitor.
It just clips in or
No, but I mean, apparently it does now. That works.
The young factory worker has already had 2 marathon surgeries in the ongoing fight to save his hand.
So they reattached my pinky, put the skin back on and all the flesh, just hoping that it would take. They took some veins from my foot to help get blood flow. I can't remember how many days after, maybe 4 or 5, they did another surgery. All the flesh had died practically, so they've stripped it all back to bone again and put it inside of my groin. So it's, yeah, I know. It's pretty crazy what they can do with medicine. They're going to grow my fingers back.
Right-handed Zach still has a long way to go physically and mentally. The impact on his life and livelihood will be huge, but he still has more good days than bad.
I've been absolutely miserable a couple of days, but I know that if I don't keep my morale up, it's just going to get worse. I need to stay positive. So all the nurses and doctors, they're working their magic to hopefully save my fingers, so I'm not going to complain. Yeah.
Royal Melbourne Emergency, Kim speaking.
A call is coming through from an air ambulance flying to the Royal Melbourne Hospital from rural Victoria with a man who suffered a horrifying accident at work.
It's all happening.
Meeting Sheridan.
Sheridan, I've also got a helicopter coming, but it's a chap who's working at an abattoir. He's got his hand crushed.
Amputated?
Yes, severed at the wrist. It's hanging on by a piece of string.
Deputy Director of Emergency, Dr. Steve Pinkers, is starting his afternoon shift as the paramedics call in.
I can get a flavour for what the day is going to be like by how busy the place is already. But as to what will actually happen during the day, what cases I'll see, what patients will present, I don't know exactly what I'm going to be doing every day. That's emergency medicine.
26-year-old Chung got his right hand caught in a conveyor belt at an abattoir. And it's been almost entirely ripped away from his wrist. Chung arrived in Australia from Taiwan just a few weeks ago. He's conscious but doesn't speak much English.
Do you speak Mandarin? Yeah. Because supposedly this patient only speaks Mandarin. So I can speak Mandarin too.
Oh,
perfect.
That worked out well.
Okay. Hi everyone. G'day mate. So we'll get him over first, guys, before we do anything.
Paramedics and the emergency team move quickly to get critically injured Chung onto the trauma bed.
1, 2, 3.
He's a 26-year-old fellow. It's been described to me that he has put his hand up in a conveyor belt type chain arrangement, and he's sustained an almost complete amputation of the right hand at the wrist. I believe it's hanging on by some skin only. I haven't taken it down to have a look at myself. It was really well dressed. First AV crews on scene found him to be conscious. They washed it out, dressed it, bandaged, gave him some pain relief, called us, and we're here.
Okay, thank you very much.
The biggest risk for us is blood loss. Because a chain conveyor is not exactly a sharp piece of equipment, it crushes as much and tears as much as cuts. We knew that he's been working in an abattoir. We knew that he had a hand injury. We didn't know the level of the injury. Was it in the hand? Was it at the wrist? We didn't know whether it would start bleeding again when we took the dressings down to have a look at it.
So what I propose we do is we X-ray the limb.
Yes.
Have a look what we can see from the outside. Is X-ray here? Can we do a shoot through of the limb in dressing? Then once we've seen that, we've got plastics and ortho here. We'll undo it once, okay? Daniel, how is his pain?
Nurse Daniel Pang translates for Chung as the trauma team prepares to X-ray his bandaged hand.
9 out of 10 pain.
9 out of 10 pain.
Let's keep going some...
Yes, you've got a bad injury to your arm.
See if
You're just going to take an X-ray.
his arm.
You're going to...
Let's have a look.
The X-ray reveals a shocking injury.
It is. It's the hand rather than the wrist, isn't it? So it's through here. It's a single limb injury, which is basically through about that level, through like that. But with that sort of level of injury, it would be debatable whether that's going to survive. So we'll do our very best, but he may end up losing the hand. That's all right.
So, whatever we can.
We're going to need to get dressings on it. Yeah. So let's get some bandages, some betadine in case it's mucky.
In Trauma Bay 2, abattoir worker Chung's right hand has been almost severed when it was caught in machinery.
Because a chain conveyor crushes as much and tears as much as cuts, my concern is that the tissue is not viable.
Dr. Steve Pinkers is preparing to unwrap the bandage to see if the young man's hand can be saved.
Guys, before you start, can we just get some pain relief on board? So give it a minute, and you can keep cutting your dressings off, just don't take the primary dressing.
Removing the dressing is very dangerous for the patient.
The key thing is we don't want blood loss. And the more times you disturb the dressing, the more chance you are going to make it start bleeding again.
Let's get the tourniquet on in case we need it. We won't do it up, we'll just put it on loose. Look, it's there, it's not going to do any harm, but it's just there. It's just there. If it suddenly starts hosing, it's there. It's going to be completely mushed. Okay, go for it, guys.
Chung's hand has been cut through and is literally hanging by a piece of skin. It's a devastating injury for the young abattoir worker.
Let's pop some betadine on.
Doctors from plastic surgery and orthopaedics examine the catastrophic injury before quickly rewrapping it.
Daniel, can you help the plastics reg consent him?
Chung is being prepared for urgent surgery.
When did you last eat? 今天吃早餐吗？有。什么几点？大概几点？Around 10 to 8. Okay. Thank you.
Nurse Daniel is translating for Chung as plastic surgeon Dr. Libby Shakula explains the risks of the operation.
Okay, how is he feeling at the moment? Can he talk?
Yeah.
So we need to go to surgery and tell him that.
我们决定就照完 X 光图呢，就要
So just to let him know, with this sort of injury, the main aim is to explore everything and see what is feasible to repair. It's a pretty bad injury. Usually when it's a twisting type of injury rather than a sharp cut, it's a bit more difficult for putting things back together.
就是说你这个伤是要怎么做的，而且这个受伤比较好。
So we'll do our best to get the blood supply flowing again and to stabilise all the bones. He may need several other operations. The worst case scenario is if that does not work, that he will lose his hand. Has he been in Australia before?
来了25多趟时间。
Okay. And does he have any family or friends in Australia?
At the Royal Melbourne Emergency, abattoir worker Chung has just been told he may lose his hand after it was almost severed by machinery at work.
He's a foreign visitor out here to work, to earn money. He's by himself, he has no social supports. It's a horrible situation for him.
I asked him about where's your next of kin. He told me that his family back in Taiwan. And then I asked, do you want us to contact them? Because we got a social worker here. And he told me, no, I don't want them to worry about me while I'm in Australia.
Alone and facing a major operation, 26-year-old Chung is about to be rushed to theatre, where surgeons will try to reattach his severed hand.
It's really hard when he doesn't have any supports. It makes it very, very difficult. The problem is partly the level of injury, but also the nature of the injury. It's crushed rather than cut. And so with that crushing, you get damage to the lining of the blood vessels, and then what happens is you get clotting. And so it's much, much harder to repair the tissues. So I would have thought he has a very high risk of losing that hand.
When abattoir worker Chung came to emergency, his hand had been crushed and almost torn in half by a chain belt. Dr. Steve prepared the 26-year-old for emergency surgery in a bid to reattach his hand.
With that sort of level of injury, it would be debatable whether that's going to survive. So we'll do our very best, but he may end up losing the hand.
Why?
How have you been going?
Good.
Good. You're looking a bit better in yourself today.
Yeah.
4 weeks later, Chung is recovering from major surgery, which miraculously saved his hand.
All right, well, let's have a look and see what's happening under here. It's healing up well.
Today, Chung has returned to hospital for a procedure to clean up his wound. Although he's still got a long way to go, the early signs are good.
I think the fact that we know the hand has survived is testament to the skill of the plastic surgical unit and the orthopaedic unit. The tissues were significantly crushed, and the fact that they have survived is really quite amazing.
It's a busy day in emergency as another air ambulance arrives with a mother of two who's crashed and rolled her four-wheel drive at high speed.
What would you like me to do?
Senior Dr. Emma West arrives to oversee the gathering trauma team.
You've got something?
Okay guys, so I've got 29-year-old Jess here, who's the driver of an 80 Series Land Cruiser today. She's lost control whilst travelling about 100 kilometres an hour. The vehicle rolling 3 to 4 times, and there was significant damage to the left-hand side of the car and the roof crushed down She's got partial amputations to her right little finger, ring finger and her middle finger.
Jess's severely injured fingers need looking at, but first Dr. Emma has to consider internal injuries.
I can see that this woman is in a lot of pain from a finger injury, and that's where all her mind is, but the car's rolled 3 times, and that's a high-speed, high-impact accident, and it's a really high risk for injury to this person, so we're pretty worried.
But Dr. Emma then finds out there's something else making Jess anxious.
She had a 4-year-old child that was killed in a car seat sitting behind her.
4-year-old child. I have a 4-year-old. I feel for her that a child involved in the car accident. It would just be awful.
She had a 4-year-old child that was essentially uninjured and had been transported to the hospital.
Incredibly, the young daughter is going to be okay. Dr. Emma can now concentrate on treating Jess's injuries.
Jess, my name's Emma. I'm just going to do an ultrasound of your belly now, okay? And then I'll cover you up after that. She has a partial amputation of 3 of her fingers, so we really need to get going on managing that. But because of the high-impact nature of this car accident that Jess has been involved in, an ultrasound is really important. So we begin with how they're breathing. Sorry, Jess, I'm just having a look at this right chest. This looks a bit different, doesn't it? Initially, on one side, there's a concern that she might have an injury to the lung. Jess, take a big, big deep breath in. Does that hurt in your chest at all? No. Are you sore over here at all? No. Okay. And not up here? No. Okay. No worries.
Dr. Emma's getting conflicting messages. The ultrasound suggests a punctured lung, but Jess has no chest pain.
One of the difficulties with the assessment with Jess is she's had a lot of pain relief and, you know, she really needs it, but sometimes it can mask a hidden injury within the torso.
The pain in the legs?
Oh, my knee, yeah.
I think it's just dislocated.
So you think there's a fracture in there? Okay.
Emma now needs to look at Jess's partially amputated fingers to see if they can be saved.
Jess, I'm just having a look at your hands now, okay? So you've just got a bandage on there. I just want to have a look underneath and just see what's going on, and then we can get an X-ray. And then I can bandage it back up. It feels a bit better bandaged up, does it? I'm quite worried about the reports of her having a partial amputation. And I know this is going to be really very painful for her. What's your 4-year-old's name?
Chelsea.
Chelsea. And apparently Chelsea's fine, is that right?
Thank God for that.
Yeah. I try and distract Jess by talking to her about her family. And although it's still painful, it's probably, with a bit of distraction, better than it could have been. Do you have other kids?
Oh, yes. Miss Charlie.
How old's Charlie?
7. Oh, no.
I'll just stop now. So just 2 kids?
Yeah.
Sorry, Dal. I'm going to have a quick peek and then I'm going to pop it all back on. You never know what you're going to see under a bandage, so you prepare yourself because how you react can have an impact on your patient. I'm just doing it very slowly because I don't want anything stuck down to cause you pain. The tips of her fingers are partially half amputated. So the finger's still there, but it's hanging off in the wrong direction. They're crushed, bleeding, there's bone and tissue on view, and her fingertips are bent the wrong way. So looking at them, immediately I'm quite worried about the blood supply. Without blood supply, her fingers could die. And then looking at how much of an open wound there is, she's very much at risk of a significant infection within the bone and her fingers. So there's a lot going on there. I'm just going to do one more thing and then I'm going to... all I want to know is, can you feel me touching you?
Yes.
And here?
Yes.
Here?
Yes.
And here?
Yes.
Are you sore over your hand? No. I'm not going to touch your fingers because I know your fingers are sore. Just your fingers. Okay, no worries. Sorry. When I'm not touching and it's bandaged up, is that More tolerable? Okay. Being a doctor and a mum and seeing some pretty horrible stuff at times, I can be that crazy parent that's always saying, move away from the road, you know, hold my hand. I'm always telling my husband what to do. I think just knowing that accidents can happen at any moment and road trauma is it's just horrible. And I just really hope that a horrible car accident never happens to me or my family, ever. So it's a pretty significant mechanism of injury. So 100 k's an hour, rollover 3 times, squashed roof. Thank God the kid's okay, and she's got maybe something in her leg, and trauma will check with plastics.
With so much going on, including a possible punctured lung, Dr. Emma needs to get Jess to both X-ray and CT fast.
My hand. If she has any other injuries, I need to know about them now. It'll allow us to look inside and see what the major organs are doing. She's really at risk for injuries to even the major blood vessel of her body, her aorta, and only a CT scan will detect what could be a life-threatening injury. Okay.
Dr. Emma's patient, car crash victim Jess, had severely injured fingers after rolling her car several times with her 4-year-old daughter inside.
And apparently Chelsea's fine, is that right?
Thank God for that.
Yeah.
Dr. Emma ordered a full scan of the young mother looking for internal injuries. But thankfully, it showed no damage to her lung or leg. Surgeons operated the next day on the 3 partially amputated fingers of her right hand.
She's had a really good outcome. She's been able to keep her fingers, which is really lucky, you know, to go 100 k's an hour, and it's so great that she was able to have them reattached, keep her fingers, and now be able to use them.
Up on the hospital rooftop, another urgent case is arriving at emergency. An air ambulance is landing with a young man badly injured in a car crash during cold and wet weather.
Is it really cold in here today?
It's freezing. I've had to put extra gowns on.
Senior emergency doctor Jonathan Papson is standing by with his trauma team.
Sounds like he's gone surfing, he's come back in the rain. Someone's just pulled out ahead of him and he's crashed into the side of them. He's been trapped in his car. He's been stuck in there for half an hour.
Usually when it comes via helicopter, it's pretty serious. It's a serious deal.
Oh, here we go.
24-year-old uni student Taylor was pinned in his crashed van in freezing conditions and is in a lot of pain.
We're going to move across and have a look at you, mate. All right? You feeling okay?
Oh, yeah.
Yeah, good.
Yeah, a bit better.
1, 2, 3. All right, 1, 2, 3.
So Taylor's normally well, driving a high ace van, T-boned a car that cut in front of him. Got full recollection of the event. He was trapped for about 40 minutes. The first ambulance crew arrived, so he was sort of spread eagle over the top of the steering wheel with his chest resting on it. There is some damage to the steering wheel as well.
Okay, all right.
Injury-wise, is apart from a little bit of bleeding from his nose, there's no obvious injury to his face, to his head.
Yep.
Neck's got no pain.
Got the wound on the leg.
Is an injury in there, which looks like a bit of dashboard's gone in and out again, and just a steady ooze of blood coming out of it. He has a little bit cold because it was quite cold.
Yeah, cold and wet.
Taylor's very lucky. A lot of people wouldn't survive this sort of crash, especially with the country road, high speed, wet conditions, older car, you know, roll the dice.
Taylor's father arrived at the crash site as his son was being cut from the van. His parents are on their way.
Does that hurt? No. Did you hit the steering wheel with your chest?
Oh, I'd assume the airbag didn't go off, so...
You had a seatbelt on?
Yeah.
Does it hurt when you breathe?
No.
No. Did you hit your face on something?
Probably the steering wheel.
With no other obvious external injuries, Dr. Jonathan turns his attention to Taylor's leg, which had been bent up against and then pierced by the dashboard of his crashed van.
So it's probably broken, isn't it? A little bit of ooze coming out.
Is that sore, mate?
No.
Looks like an open fracture bleeding.
So an open fracture is where the fractured bone is exposed to the environment, which means it's just going to get infected unless you do something about it. And it's a bad thing to happen.
The injury is potentially devastating for Taylor, who works as a surf coach and has important uni exams coming up.
And your leg's quite sore, yeah?
Yeah, both of them.
Yeah, both.
What about those toes? Well, yeah, that's my big toe. The toes really sore. And the next one.
Both toes numb? Both feet? Or one?
These are sore. Those are kind of numb.
Does that hurt?
No.
For something like this, what are the real problems going to be? It's going to be chances of infection. Is there a problem with the blood supply to the toes? Has the main artery down there been compromised by the fracture, by the bones moving?
So the fast is looking normal and the chest looks normal.
If it's an open fracture, which means he's got bone poking out, then there's always a potential of amputation. So there's always a potential that he's going to lose his leg. That's the real deal here.
How old are you?
24.
Over in Trauma 1, Dr. Jonathan Papson's patient Taylor is waiting for the X-ray results of his right leg, which was severely injured in a car crash on his way home from the beach.
Because you're going how fast? Like 80, 100 or?
Realistically, probably 90.
90, yeah.
The X-ray results are ready and confirm Dr. Jonathan's suspicions.
So he's got a fractured shaft of the tibia, which is not a good injury to have because it's open to the environment. You can get an infection from there. So it's actually quite a serious injury to have. If it gets infected, that's big trouble.
It's a broken bone under there.
Yeah, right.
And you can tell because you see how the blood's like a little bit fatty? It's probably coming from the middle of the bone because it's got marrow.
Jonathan calls in specialist orthopaedic surgeon Dr. Patrick Elias to see what can be done to save Taylor's leg.
It looks like it's open, so it's a grade 1. This is a pretty significant injury, and the complications associated with this can be limb-threatening, so we need to do an operation on this as soon as we can and insert a metal rod down the bone and use some screws to secure that rod.
We're giving him antibiotics, we're going to wash it out, but there's still a high chance this leg of his is going to get infected.
Just a wave of that?
No.
Taylor's parents, Maury and Joelle, have arrived to see their son.
So you guys just give us heart attacks, you did? Which one? You and your brothers?
Taylor phoned his dad while he was still trapped in the van.
I was doing some gardening and the phone rang and Taylor just said, "Dad, I've had a bad accident and I think I've broken both my legs." I said to him, "Call an ambulance," and he said, "We already have." And then he told me where he was, so I said, "I'm on the way." Driving down there, I tried to ring him back and he didn't answer his phone. That's where I was thinking something terrible's happened. I got down there and, there were police and ambulance, everybody all around the place. And the car was just absolutely written off. He was pinned, his legs were pinned in the van and it took them a while to cut him out. They had to obviously cut the van and he was in a fair bit of pain. It was cold, it was raining, it was just a shocking day.
People lose their legs all the time in crashes like that. I've seen the van, he could lose his leg. We will do everything we can to make sure that doesn't happen.
Any questions about it?
Orthopaedic registrar Dr. Timothy Chung prepares Taylor for the major surgery he's facing.
There's some risks involved. Our hope is to give you one operation, which is rods, then recovery of about 6 months.
It's overwhelming news for the surf coach and uni student whose life will be dramatically changed by the accident.
So, what do you do for work? Surf coach, but I'm a student. So you're 6 months away from being able to surf.
It's going to be awful for him not to be able to do what he loves doing. It's totally unexpected. It's come out of the blue. It might be totally devastating for him. That's his job.
Doctors will need a CT scan of Taylor's broken leg to see the full extent of his injury before he goes to surgery.
He's going to have pins and an external device put on his bones to hold the bones in place. And then he's got a wound there that needs to be cared for, and then you've got to worry about all the other things, the tendons and the arteries and the nerves that might have been injured as well. So it's much more complex.
Dr. Jonathan Papson's patient, Taylor, is being prepared for major surgery. The 24-year-old surf coach is in danger of losing his leg following a serious car crash. Taylor's badly broken limb is being wrapped in plaster to keep it stable until he goes to theatre.
Trouble is when you lift the leg up, the bone sort of sags a bit, and that obviously hurts. You remember the fracture, there's a jagged bit. So I don't blame him for being uncomfortable. So, I can hold the plaster if you want to get the bandage. So you've got the foot.
Any lower limb injury that's open to the environment, if it gets infected, you lose the leg or you lose part of the leg. That's the real risk. So there's a risk of infection, and even despite antibiotics and the best possible treatment, it can still get infected.
But we just have to have it like that because it needs to be in the right spot.
His dad, Maury, is worried about the impact on Taylor, who's studying environmental science and about to sit exams.
There are some memories in my mind, some pictures in my mind that will stay with me forever. You know, just below the vehicle, there was this puddle of oil and blood and rainwater all mixed in, and that was just a horrible thing to see. It'll be no different for Taylor, though. He'll have some horrible memories as well.
Someone's looking after me. I mean, I saw a picture of the car and it's amazing it's still got legs left, to be honest.
Dr. Jonathan has done all he can for Taylor. He's now going to theatre for surgery to try and save his leg. When surf coach Taylor was airlifted to emergency with a shattered leg from a high-speed crash, Dr. Jonathan was concerned there was a risk of amputation.
If it gets infected, that's big trouble.
Jonathan cleaned and plastered Taylor's badly broken leg before an operation to try and save it. 3.5 months later, the uni student isn't back riding the big waves yet, but he has managed to dip his toes in.
So I went from not being able to take a single step, and then I actually went for my first surf yesterday. So that was pretty exciting.
His leg was saved after marathon surgery where a titanium rod was inserted from his knee to his ankle.
This experience definitely has changed my outlook on life. I think this accident has strengthened my relationship with my dad. Like, he found it really difficult to be at the accident site and to see me in that situation.
It probably gives us a good outlook on life now. One of the police guys at the thing said to me, someone up there was looking after him, and, we truly believe that.